So tell us a little bit about the history of privacy in medicine and how that has changed over the last 70 years.
Well, you touched on it being a few thousand years old in the Hippocratic Oath, which most people know the first do no harm. But within the oath is what you tell your doctor remains with your doctor. And it was put there for good reason. If you can't trust your physician to keep your confidence, you're not going to tell them the whole truth and nothing but the truth, which affects diagnosis and treatment plans. So it's been around a lot longer than even the attorney-client privilege. And if you ask any lawyer what happens to the legal profession if you lose attorney-client privilege, they'll tell you that's the end of the profession. You're hamstrung. And I'll give you a good suggestion for a guest. That would be Dr. Craig Wax, who wrote a great article called Legal Care for All. He opened up a few doors. It was a tongue-in-cheek article, but hey, Miranda rights, you have the right to an attorney. And if you can't afford one will be appointed for you. Opens up some interesting conversations in terms of comparing it to Medicare for All and client-patient privacy. So fast forward a bit to the 1990s when HIPAA was introduced. And before that, and up until that point, doctors and hospitals mostly were getting into electronic health records by that time in their rudimentary form. And then HIPAA came along and cracked open the door to patient privacy. It allowed a lot of people in. And the P in HIPAA doesn't stand for privacy. It stands for portability. So you can take your insurance with you, or it was easier for you to get coverage if you left your job, since most insurance is tied to employment. And it's amazing. We could have prevented that whole deal if we just done health savings accounts the right way and opened them up to paying direct. But it was a little early for that, because that's really when direct primary care was getting underway. Back in the mid to late 90s is when it started. And then along comes 2005, 2006, when Medicare and the US government said to all primary care doctors, guess what? If you want to get reimbursed, you need to have electronic health record system in your office. Which brings up the subject of how do you audit Medicare payments? Well, and you've got to audit them. I mean, there's got to be an audit mechanism. You're spending taxpayer money. So what happens? They send in usually a registered nurse, and it was an accountable care organization that would do that. They'd send in a registered nurse who'd sit down at the software program, the desk, and have access to all the patient records, including non-Medicare patients. So it raised a lot of questions. And then you had the Affordable Care Act, which didn't help. It facilitated more access. And if you look at, there's a ruling, or it's in the Federal Register as of December 2016, that the federal government, in the form of CMS, the Center for Medicare and Medicaid, they have access, and unfettered access. And they say they're doing surveillance of electronic health records without patient authorization. That wording is in the Federal Register. That's really never seen a courtroom. That was approved by the Office of Civil Rights. And I read that and I thought, wow, the Office of Civil Rights. I wonder, what's that? Is that in the Supreme Court? I mean, is that the WHO? I mean, who is it? Well, it turns out that every department in the government has an Office of Civil Rights, apparently, and so does the Department of Health and Human Services. Guess who approved it? The Office of Civil Rights and the Department of Health and Human Services, which is essentially like the wolves guarding the hen house and asking themselves, is it okay? Right. It's just, only a government could come up with that. But that's how they are. That's when I say the old antiquated and radioactive system what I'm referring to is the current healthcare system. And the radioactive part of it, you can measure the fallout. The fallout is on the Department of Health and Human Services breach portal. So if you have a database of healthcare patients, over 500, and you have a breach, you have to report it. So they conveniently monitor the fallout from their own misadventures in doing spying on healthcare records. And you can go online and look. And it's not fun to do that. I mean, it's interesting, but it's not fun. It's discouraging when you see breaches. And breaches can be determined. It could be losing a laptop. It could be a hacking. It could be ransomware. And it's an insidious situation that we have now. And it's a threat to people, especially to people who don't give privacy a second thought. Oh, I don't have anything to worry about. I don't care if someone sees my record. Yeah, well, that's fine for you. But what about people who've had rapes, abortions, adoptions, mental illness, drug addictions, you name it? Spring break's gone wild on Mars. Yeah. And it winds up on the internet. You probably have friends that have told you things in confidence because they don't want to tell their mom or dad, lest they go ballistic. So it's an insidious situation that needs to be addressed. And while there's bad news on that front, we can get to the good news that there are some disruptors out there. But this has been a long, slow motion train wreck. And it's not been helped by what people consider to be the privacy, the HIPAA. When you think of medical privacy, you think of HIPAA. That just cracked open the doors. You've got 2.5 million entities that have access to what they call anonymized personal health information, except it can be re-identified, and that's been proven. So what are we doing here? We have to have this conversation, or we are going to lose medicine as a profession. It just can't. You can't have good diagnosis and treatment plans if you're not getting the right information as a physician.
Well, and I think one thing over the last 2 or 3 years, the system has really been exposed. I mean, people's medical privacy has been violated over and over again, by making things public, whether it be through your employer or whether it be, through many other means. And, it used to just not be that way. And so I think now, unfortunately, kind of like you're saying, or maybe you didn't say this, maybe we were talking about this before the show, but people are going to be fearful to maybe talk about things they really need to talk about or want to talk about with their doctor because they're worried about privacy issues.
What happens? I mean, the knock-on effect from that is horrible. And it even extends into your profession. Because if you're an attorney, and if I think like an attorney, a pit bull, and I have a client who either died or died from a misdiagnosis because the client didn't say everything that was going on, and they were prescribed a medication, and prescriptions are like 1/3 of all malpractice claims. I think it's 1/3, but it's a major player in malpractice claims, getting being prescribed the wrong drug. So if the patient dies, no one knows. They can't admit it in court that, oh, well, yeah, I kind of neglected that I do cocaine every now and then.
Right.
No, not with that medication, right?
Right.
And so who's going to get the blame? The doctor. And perhaps if I'm an attorney, I'm going to loop in the pharmacist too, because I know you got malpractice insurance.
Yep.
Good. You'll settle out of court. Your insurance company will settle out of court. You may not like that, but hey, it's up to them. They're paying the claim. What happens to what happens to malpractice insurance cost?
Right.
It's going up. Interestingly enough, malpractice claims go down with the improvement of the doctor-patient relationship.